Boostaro is a supplement that's marketed for, male intimacy enhancement. Well, given the reputation for these types of supplements, I already have my doubts. But let's suspend disbelief for a bit and dive into the evidence. What does actual human research have to say about the ingredients in Boostaro, and does it work? Here are the ingredients per capsule. The recommended daily dose is 2 caps. Let's analyze the doses they use, whether they're using the active compounds to work, and whether there's any evidence it can actually help with male intimacy issues, such as ED. When it comes to using vitamin C for ED or other intimacy issues, there's absolutely no human evidence supporting its effectiveness. The closest research I could find revolves around testing vitamin C supplements to see if they enhanced general physical activity in elderly men. Unfortunately, a small clinical study revealed the opposite effect. Among elderly men undergoing strength training, taking vitamin C with vitamin E daily for 12 weeks did not lead to increased strength. In fact, taking vitamin C might have even reduced muscle mass gains. So in the realm of physical performance, vitamin C supplementation is not beneficial and could even be counterproductive for elderly men looking to boost physical performance. Boostaro claims that vitamin C aids in maintaining healthy arteries and cell walls. However, just because a nutrient plays a role in blood vessel formation doesn't mean that increasing its intake will bring added benefits to blood vessels or cardiovascular health. In fact, studies show that taking extra vitamin C through supplements does not seem to offer any advantages for preventing cardiovascular diseases, whether it's for primary prevention or secondary prevention. When it comes to using vitamin K for tackling ED or other intimacy issues, there's also no human evidence supporting its effectiveness. Boostaro claims that vitamin K helps support, quote, health, blood flow, and heart health. Nice grammar, by the way. However, numerous observational cohort studies have shown that increasing vitamin K intake through supplements or diet does not lower the risk for most cardiovascular events. Moreover, having higher levels of vitamin K in your blood doesn't seem to decrease the risk of cardiovascular disease either. So contrary to Boostaro's claim, the research suggests that taking vitamin K supplements likely does not significantly improve blood flow or heart health. L-Citrulline is a non-essential amino acid found in watermelon, squash, and pumpkins. The research would suggest that it does seem to boost nitric oxide levels in the blood, leading to vasodilation and mildly better blood flow. In a small study involving adults with mild ED, those who took L-Citrulline saw an improvement from mild dysfunction to normal function in 50% of participants, compared to only 8% of those taking a placebo. However, it's worth noting that the dosage used in the study was 1.5 grams per day, which is considerably higher than what Boostaro offers. Even then, the evidence supporting L-Citrulline for ED is still weak, and it seems to be most effective for mild cases of ED, with benefits possibly taking over a month to become noticeable. Lysine is an essential amino acid found in meat, fish, dairy, eggs, and some plants. However, there's no human evidence supporting its effectiveness for treating ED or other intimacy issues. Boostaro claims that L-Lysine might help maintain healthy arteries by improving cholesterol levels. However, there's no evidence to back up this claim. In fact, a study examining the impact of L-Lysine and vitamin B6 supplementation on fat levels in the blood found that men taking 1 gram of lysine daily for 12 weeks with or without vitamin B6 did not affect the fat levels in the blood. The maritime pine is where we get pine bark extract from. It's commonly used in supplements for various health conditions. Pycnogenol is a specific extract of pine bark which is derived from the French maritime pine, which is trademarked in the US. There's some weak evidence suggesting that pycnogenol might be helpful for mild to moderate cases of ED. Combining pycnogenol with L-arginine could also be useful in managing ED, but the overall evidence is weak, and it might take up to 3 months of consistent use to notice any significant improvement. However, it's important to note that these studies specifically use the branded extract pycnogenol, not generic pine bark extract like the one found in Boostaro. So while the patented form may show some weak evidence for improving ED, the generic versions don't. When it comes to magnesium, there's no human evidence regarding ED or other intimacy issues. Boostaro suggests that magnesium aids in maintaining flexible arteries and capillaries, which sounds a lot like they're claiming that magnesium can help with atherosclerosis, which is hardening or calcification of the arteries. However, clinical studies paint a different picture. They indicate that taking magnesium supplements does not improve coronary artery calcification or CAC scores compared to standard therapy. CAC scores are measurements that show how much calcium is built up in the coronary arteries. In other words, how hard or how inflexible these arteries have become. A large clinical study found that taking magnesium does not slow down the progression of CAC scores compared to a placebo. So, while magnesium offers various other health benefits, supporting artery and capillary flexibility does not seem to be one of them. Nattokinase is an enzyme derived from fermented soybeans. However, there's no human evidence indicating its effectiveness for treating ED or other intimacy issues. There are apparently many other counterfeit versions of Boostaro out there, but I focus on analyzing the ingredients from the original formulation. However, when comparing the label on the bottle with their website, the website lists 2 additional ingredients, CoQ10 and L-Proline, that aren't actually present in the bottled supplement. Now, I'm not sure if the website is just outdated or they're just lying about it, but this is just more misleading and incorrect information on the Boostaro website. And if you're curious about whether CoQ10 or L-Proline could hypothetically help with ED or other intimacy issues, the answer is no. There's no human research supporting these uses. Overall, Boostaro is not likely to make any significant impact on ED, improve any type of bedroom performance, or help with other intimacy issues. It also markets itself as beneficial for blood flow and cardiovascular health, suggesting that improving these aspects could also help with ED. Indeed, research tells us that cardiovascular disease is closely linked to ED. In fact, signs of ED often show up 3 to 5 years before noticeable signs of heart problems show up. So if you are experiencing ED, it's probably a good idea to have your doctor take a look at your heart first. Unfortunately for Boostaro, however, studies indicate that the majority of the ingredients within it don't actually support cardiovascular health or improved blood flow. Essentially, Boostaro is not much more than a combination vitamin C and K supplement. Neither of these vitamins have proven useful for male enhancement or cardiovascular health, and the other ingredients in Boostaro are either too low to have any significant effect or don't use the correct extracts. Boostaro is selling for around $70 per month. If I want to replicate what I was trying and failing to do, but actually do it correctly, I would combine a proper dose of L-Citrulline and pycnogenol. L-Citrulline is $3 to $4 a month. Pycnogenol is around $20 a month. Combined, that's only $23 to $24 a month for a far more effective solution. Rating Boostaro by effectiveness for male enhancement, I'm giving it an F. It's completely useless and isn't much more than a vitamin C and K supplement. Rating it by cost, I'm giving it a D. You can get vitamin C and K together for no more than $10 a month. Rating it for safety, I'm giving it a B. The ingredients are unlikely to cause significant side effects or much effects at all. Overall rating, I'm giving an F. I would recommend you stay away from it. Hi, I'm Dr. Brian Young. Do you think it's worth it? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell to stay up to date and share this video with someone you know who can use the info.